Hi, I'm Dr. Gary Kaplan, and it is my great privilege and pleasure to be here with Dr. Kiprov. Dr. Kiprov is an internationally recognized immunologist. He is worldwide recognized for his work in therapeutic plasmapheresis, and will explain to us what plasma exchange is. We are particularly excited because we're going to be able to bring this technology to Northern Virginia, which we've been trying to do for the last 4 years. And Dr. Kiprov has now made it possible for us to be able to do that. So what we're going to do is I've been out here training. We're out in Mill Valley, California. I've been picking Dr. Kiprov's brain for several days now, and he's still willing to put up with me. So I want to turn this over to truly a giant in the field of immunology, Dr. Kiprov, and talk about first, if you would, what therapeutic plasma exchange is.
Therapeutic plasma exchange is a medical procedure which is performed with sophisticated equipment. It basically involves removal of the blood into the machine. The machine separates blood into its components, which is red cells, white cells, platelets, and plasma. In most diseases, we remove the plasma because it contains substances that cause diseases and contribute to aging, and replace it with physiologic fluids. In some of the other diseases, we may have to remove white cells or red cells, depending on the condition.
Therapeutic plasma exchange, or TPE, refers to a specialized medical procedure in which blood separation technology is used to remove abnormal plasma constituents. Whole blood is removed from the patient into a blood cell separator, which utilizes centrifugal forces to separate whole blood into its individual components: plasma, platelets, white blood cells, and red blood cells. Plasma can be removed and replaced with physiologic fluids to treat relatively uncommon but usually life-threatening diseases.
So you pioneered the outpatient use of therapeutic plasma exchange. This was previously confined only to hospitals, and you use it for a number of conditions. The machine itself is FDA approved, so that process is FDA approved, though this is an off-label use for some of the therapies that we're going to be using it. But you have experience with PANDAS, you have experience with longevity, you have experience with post-COVID with these conditions, and I'd like you to talk about those if you would. You've published on them and some very exciting work.
Right. Until about 10 years ago, therapeutic plasma exchange was limited to hospital setting, as you said, and most of the patients were in critical condition, and most of the procedures were performed in ICU setting. A few years back, we performed a international controlled clinical trial in Alzheimer's disease, mainly in Barcelona in Spain and in the United States, predominantly in Florida and New York. We performed all these procedures in neurology clinics outside the hospital, and we really saw very few, if any, side effects. So at that time, I thought that there is no reason for Alzheimer's patients to go into the hospital and spend enormous amounts of money in a hospital setting, and we started doing them on an outpatient basis. At that time, some new conditions that you mentioned started to emerge, and again, they may not be new conditions, but newly recognized by us. Some of them were brought by COVID, long COVID, for example, and others were brought by the recognition of the etiology, the underlying problems related to PANDAS and similar conditions in adults.
So one of the things that was particularly exciting in the Alzheimer's study is that you showed a dramatic slowing of the disease, certainly compared to what we're seeing with the anti-amyloid drugs. So the anti-amyloid drugs clock in at about 18 to 30% slowing of the progression of the disease. Please understand, we do not have a cure for this disease yet. But in the study that you did with Grifold's big study in Alzheimer's, tell us what you saw in terms of the slowing of the disease.
Yes, we were able to demonstrate 67% of patients didn't progress. And for Alzheimer's disease, this is very important because it's a progressive disease and eventually kills its victims. But we stopped the progression of the disease in 67% of patients with moderately severe disease. In milder form, we had even better success, and we saw improvement in about 30% of the patients.
And Alzheimer's is a chronic disease, so this is not a one and done situation.
Right.
We have to do a series of plasma exchanges on them and then follow them up over a period of time. Could you talk about that?
Yes, it is a chronic disease, and the treatment, whatever treatment it is, will be most likely for life. So then this makes things very expensive, obviously, especially with what exists now. But with the monoclonal antibodies and what we do, it's all expensive. So we have to be careful with that and try to make programs that are acceptable to most people. So I'm not sure we're very successful in that because the treatment is expensive to begin with, and the only way to reduce cost will be to scale it up.
I think the other thing to keep in mind is that I don't know that these treatments are for life because we get better at what we're doing. There's a lot of new drug development occurring. There's a lot of new therapeutic developments occurring. And so the name of the game is buy time. Buy time to the medicine and the science can catch up so that we, in fact, can potentially cure this disease.
I fully agree. Unfortunately, I don't see anything coming soon. So,
well, I'm going to remain optimistic. As you know, I have a dog in this race, so I would love to see a cure for this disease. But we can at least slow the progression of it and keep a high quality of life.
Right. At the moment, this is the goal. I'm all in the development of new and more promising treatments, and I'm sure we will. There's nothing in the next 5 years, but maybe beyond that, there is hope.
With regards to treatment for PANDAS, okay, another area which is very challenging. Mostly what we're stuck with at this point is IVIG or rituximab. The problem is these are also expensive therapies. These are also therapies which are frequently not curative, but control. You and I have talked at length about using therapeutic plasma exchange as part of the process of controlling these autoimmune encephalopathies that occur in these kids, and where you think it belongs in the treatment, and what you think in terms of follow-up. You also had some very interesting things to say about the dosing of the IVIG for these therapies. So
Right.
Start with where you think we should begin with.
Just about every patient with PANDAS we see has been on other therapies that have failed. So obviously, people are looking for better approach. And therapeutic plasma exchange, in our experience, appears to be a very promising approach. Just about every kid that we have treated has responded well. Granted, some of these patients need treatment for months, maybe a year or so. This does not eliminate the other drugs, the other approaches. I think the combination of therapeutic plasma exchange and IVIG plays a significant role in the treatment of PANDAS as well as other autoimmune diseases. Rituximab can be used. We don't like to use it a lot because of side effects, especially in younger individuals. But the combination of the plasma exchange and IVIG has proven to be very successful in other autoimmune diseases as well as organ rejection. So transplant rejection. So we use a model that was developed in Johns Hopkins for rejection of renal kidney transplantation, and they use considerably lower dose of IVIG after plasma exchange. And in our experience, and we have been doing this for several years now, this works just as well. And if this were the case, then we can save enormous amounts of money, side effects, time, and so forth. It's considerably better to use lesser dose of IVIG than higher dose. And our own results are supportive of what was found in Johns Hopkins, and we think that it works well.
And the dose we're talking about is 100 to 200 milligrams per kilogram as opposed to the 1.5 grams per kilogram. And you say that you're finding every bit as good results, which is a dramatically less amount of IVIG, dramatically cheaper, and potentially better.
The reason maybe, I'm speculating here, but the reason may be that just about every study related to IVIG was done on a high dose.
Mm-hmm.
And just about every study on IVIG, except for ours, has been, and the ones in Johns Hopkins, have been done without the plasma exchange, just IVIG. So there is very little experience, or certainly not enough, to claim one way or the other, but it is possible that the combination of plasma exchange and lesser dose of IVIG has different dynamic and different function pathophysiologically and physiologically than the high dose IVIG alone.
And you were talking about starting with plasma exchange
Exactly.
as your first therapy, then moving on, if necessary, to IVIG or rituximab.
I think this is very important, and people have done the other way around, which is really, it's not logistical. To me, it does make sense. But overall, there is a hesitance of using therapeutic plasma exchange. Physicians, unfortunately, don't understand what it is. They think it's very dangerous. It can be done in ICU and all that. We have proven them wrong, and this is all new to most people. We know that it's fairly benign, and starting with it by removing autoantibodies as well as other substances from the blood and then immunomodulating the whole system is much more, it makes much more sense.
So, also wanted to talk about longevity, because you just published a big study on longevity. Tell us about the use of therapeutic plasma exchange in longevity.
Right. I'm not a big fan of the term longevity. I think that what we are aiming here is expanding health span.
Mm-hmm.
The health span of people varies from country to country, but overall, the health span of people is in good shape. We don't suffer from any diseases until we reach a certain age, which in this country is about 55, 60. And then there is explosion of chronic inflammatory diseases like heart disease, stroke, but type 2 diabetes, cancer, Alzheimer's disease, a variety of diseases associated with aging. So clearly aging is a contributor to that. Whether you consider aging as a disease or not is irrelevant. What is relevant that aging is if not the cause, it's an association with these diseases. So we do keep people alive with these diseases because medicine has made major strides over the last 50, 70 years. But these people are not healthy. They're in a wheelchair, they're suffering, they're taking 72 drugs every day, and they're not productive. And keeping them alive costs enormous amounts of money. $4 billion last year to the United States. So if we can intervene preventively, prophylactically, around age 50 or 60, maybe even younger in some situations, and prolong the health span of people. So instead of developing these diseases that I mentioned around the age of 50 or 60, they can live without a disease until they are 80. That will save enormous amounts of money to any country, and these people will live healthy and productive life. They will enjoy continuing to work, enjoy life, enjoy their families and so forth, and not suffer with a variety of chronic autoimmune. So our goal is to develop a treatment or a preventive measure to prolong the health span of these diseases. And it turns out that therapeutic plasma exchange is part of this approach. There are two other things, and one is the Mediterranean diet, the other one is exercise. These are well scientifically proven approaches, and they stand. And if we add the medical procedures such as plasma exchange, I'm confident we can do that. And in a controlled fashion, we showed that we can.
And the other thing I want to talk about is post-COVID. So, massive problem. We're looking at anywhere from 10 to 30% of people who develop COVID developing a post-COVID syndrome. You've had good success with therapeutic plasma exchange. Can you tell us about that?
Yeah, we saw the first patients with long COVID approximately eight years ago, and we were the first ones to publish the use of therapeutic plasma exchange in this condition. At that time, and even now, there is very little known about this disease. In fact, there are people that don't believe it exists. So you and I know
certainly
that,
not those suffering from it.
Yeah, you and I and the patients know that it does exist, and it can be very disabling, very unpleasant. It is very well established and accepted now even by the NIH that it is an autoimmune disease following an infection, which is a process that we have known for years, but since COVID is a new disease, or newly to us, and this is associated with it, it's considered a new disease. I think that similar to other autoimmune diseases, therapeutic plasma exchange has a role to play in approaching the overall treatment of this disease. It may not be the only thing that is going to affect the disease, but it's certainly one of them.
So one of the other things you and I talked about is fibromyalgia. And you've had some experience treating patients with fibro, these generalized pain syndromes.
Right.
Can you talk about that a little bit?
I don't think that this is a single entity. I think that the symptomatology of fibromyalgia may have underlying conditions. So in situations where inflammatory reasons are underlying, then plasma exchange definitely is going to help because it has its very potent anti-inflammatory effect. There are other conditions that predispose to the development of pain and overall fibromyalgia, and I'm not sure that we can, with plasma exchange, can affect those. So some patients will respond. These will be the inflammatory ones. Some patients will not respond, and these are probably due to other conditions or inflammatory condition that has gone beyond repair. Fibrosis, for example, can follow inflammatory condition, and then at that point we cannot do
Tissues are
anything.
too damaged,
Yeah.
so we can't do anything. Well, I'm extremely excited about being able to work with you and collaborate with you. We've got a couple of research possibilities that you and I have been talking about. I'm very excited to be bringing this therapy to the office in McLean, and looking forward to being able to have a tool that I believe is going to be able to help hundreds, if not thousands, of more of our patients as we move forward, and looking very much forward for the collaboration with you.
We too. We would love to have you on board, and looking forward to working with you, to visit you and in the new clinic and do some patients together. It will be great.
Very excited, Dr. Kiprov. Thank you.
Great. You're very welcome.